Acupuncture is my life. AcupunctureIsMyLife. Let us begin.
Hello everyone, and welcome back to my show. Now for this week's interesting case topic, I will be discussing headaches. Now headaches basically present with diffuse pain in different areas of the head, which has subjective symptomology. Now sometimes it occurs independently, but most times it occurs with other symptoms in the process of acute or chronic diseases. Now your entire head may be affected, or the pain may be localized to frontal, temporal, occipital, or vertex regions. Now, pain can radiate to your eyes, cheeks, or teeth, but in Chinese medicine, we have an awesome, although interesting approach to dealing with headaches. Diagnosing headaches in Chinese medicine, we can obtain a clearer understanding as to what's going on in a particular meridian within the body. Now, in Chinese medicine, the head is the merging area for the clear yang of the body, as well as the location of the sea of marrow. Now, pain in the head results when the clear yang is obstructed, or when nourishment to the head from qi and blood in essence is inadequate. Now, relevant diseases tied to headaches are meningitis, migraine headaches, trigeminal neuralgia, sinusitis, glaucoma, hypertension, or head injury, to name a few. Now, when it comes to Chinese medicine, headaches are usually caused by exterior pathogenic factors or internal organ dysfunction. When it comes to exterior pathogenic factors, wind is the primary pathogenic factor. Wind, which is yang in nature, has the ability to attack the merging point of all yang, which is the head. Wind in Chinese medicine is the leader of all exterior pathogenic factors because it's seen as the carrier of all pathogens which invade the body. One example is wind cold. Wind cold can congeal qi and blood, which can obstruct all collaterals within the body. Another example is wind heat. Wind heat tends to flare upwards, disturbing clear orifices. Then you have wind damp. Wind dampness tends to injure yang qi and block the flow of qi, veiling the clear orifice and preventing clear yang from ascending. Now, when it comes to interior organ dysfunction, the brain in Chinese medicine relies heavily on essence and blood from the liver and kidneys for nourishment. Now, the brain also depends on the spleen and stomach to transform and transport water and food and to distribute qi and blood upwards to the head. Now, with that being said, dysfunction of the liver, kidney, and or spleen leads to malnourishment of the head. To accompany that, formation of phlegm, secondary to dysfunction of spleen, can also inhibit clear yang in reaching the head. Now, in Chinese medicine, as stated earlier, headaches can inform us as to disturbances in a particular meridian or channel. For instance, headaches starting from the back of the head or occipital region down the neck would be considered a Taiyang headache. Headaches that traverse the forehead and eyebrow regions are considered Yangming headaches. And headaches that traverse the temporal region bilaterally and or the auricular regions are considered Xiaoyang headaches. Those that go from the vertex and connects to the eye system are considered Jueyin headaches, and headaches radiating to the cheeks and teeth are considered Xiaoyin headaches. Now, basic patterns for headaches in Chinese medicine from an exterior perspective include wind cold headaches, wind damp headaches, and wind heat headaches. Now, interior patterns can be diagnosed as liver yang headaches, blood stasis headaches, phlegm turbidity headaches, blood deficiency headaches, or kidney essence deficiency headaches, to name a few. Now, for exterior headaches, I would look to expel the pathogenic factor. And for interior headaches, I would tonify the deficiency primarily. For complex patterns of excess and deficiency, I would have to determine the root and branch of the problem, then treat it accordingly. Now, my interesting case of the week was a phlegm turbidity headache. The patient showed signs of headache and dizziness and cloudiness of the head. His symptoms were full and stuffy sensation of the chest and the epigastrium, nausea, and he was vomiting phlegm and saliva. He had a white, greasy tongue coating, and his pulse was wiry and slippery. Along with an herbal formula recommendation, the acupuncture points that I used was Zhongwan, Fenglong, Bai Hui, in tongue. And after 3 treatment sessions, the patient stated his headaches had disappeared. Now there you have it, my interesting case of the week. Now don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?